T was an ordinary day. The sun was shining, birds were chirping, and traffic moved steadily along the city streets. Among the cars and motorcycles, one man, Ali, a 32-year-old office worker, was riding his motorbike, heading home after a long day. He was wearing a black helmet, a gray jacket, blue jeans, and sneakers. His hands gripped the handlebars tightly, and he hummed a tune, unaware that within seconds, his life would change forever. Suddenly, a car from a side street ran a red light. Ali didn't have enough time to react. The motorcycle collided with the car. The sound was deafening, metal scraping against metal, tires screeching, and a loud thud as Ali was thrown off his bike. He hit the asphalt hard, sliding several feet before coming to a stop. Immediately, chaos ensued. Passers-by screamed. Some ran toward him, while others called emergency services. Ali lay on the road, struggling to breathe. His helmet had partially protected him, but he was conscious, disoriented, and in immense pain. He tried to move his leg and felt a sharp, stabbing pain in his thigh. His arm throbbed, and blood oozed from a cut on his forehead. Panic set in as the shock of the accident took hold. His heart raced, his hands trembled, and his breathing became shallow. One bystander, a nurse named Sarah, rushed forward. She crouched beside him and assessed the situation. First, she checked his airway. Ali could speak, but his words were slurred. Next, she checked for breathing and pulse. Both were present but rapid. She noticed the bleeding on his forehead and leg and quickly applied pressure with a clean cloth. She told him to remain still, explaining that sudden movements could worsen injuries, especially if his spine was affected. Meanwhile, someone had called the ambulance. Within minutes, sirens pierced the air. The paramedics arrived, carrying a stretcher and medical equipment. They moved with urgency but care. Ali was conscious enough to answer questions. His name, age, allergies, and medical history. Paramedics immobilized his neck using a cervical collar and carefully lifted him onto a spine board to prevent further injury. His blood pressure was elevated, and his heart rate remained high due to pain and adrenaline. In the ambulance, paramedics started in 4-line to administer fluids, ensuring Ali didn't go into shock. They monitored his oxygen levels and applied a bandage to control external bleeding. Ali's vision was blurry, and he felt nauseous, classic symptoms of trauma and shock. The paramedic explained every step, trying to calm his racing mind. Arriving at the hospital, Ali was quickly moved into the emergency department. Doctors and nurses took over. A trauma team assessed him using the ABC protocol: airway, breathing, and circulation. His airway was clear, but a CT scan was ordered to check for internal injuries. His breathing was shallow, and he had minor abrasions and bruises all over his body. The scan revealed a fractured femur, a mild concussion, and several deep lacerations. The orthopedic surgeon explained that Ali would need surgery to fix his broken leg. The neurosurgeon monitored him for potential brain injury, while the plastic surgeon planned to close his lacerations. Ali was prepped for surgery, given anesthesia, and moved into the operating room. Hours passed as the team worked meticulously. Bones were aligned and secured with metal plates and screws, cut-stitched, and careful monitoring continued to prevent complications. After surgery, Ali was transferred to the recovery room. The effects of anesthesia left him drowsy. Nurses checked his vitals regularly, ensuring his heart rate and blood pressure stabilized. Pain management became a priority. Medications were administered to control the throbbing pain in his leg and discomfort from injuries elsewhere. His body began the natural healing process: inflammation at injury sites, blood clotting, and tissue repair. Recovery wasn't just physical. Ali faced emotional trauma as well. Flashbacks of the accident haunted him, and he experienced anxiety about riding again. Doctors explained that psychological recovery is as important as physical healing. Counseling and therapy were recommended to help him cope with post-traumatic stress. Over the following weeks, Ali's hospital stay continued. Physiotherapists helped him regain mobility, teaching exercises to strengthen his leg and improve balance. Nurses assisted with daily care, monitoring for signs of infection or complications. Family and friends visited, providing emotional support, which played a crucial role in his recovery. Gradually, Ali's wounds healed. Stitches were removed, bruises faded, and the fracture began to knit together. Pain diminished, though stiffness and soreness remained. He practiced walking with crutches, then slowly transitioned to a walking aid. The journey was challenging, requiring patience, determination, and professional guidance. Finally, after months of treatment and rehabilitation, Ali regained most of his mobility. He learned the importance of road safety, wearing protective gear, obeying traffic rules, and staying vigilant. The accident left scars, both visible and invisible, but it also taught resilience. Ali returned to life with a deeper appreciation for every moment and a commitment to safer practices on the road. Road accidents are sudden, often traumatic events. They can result in physical injuries ranging from minor cuts and bruises to life-threatening fractures, head injuries, and internal bleeding. Immediate medical attention, proper immobilization, and timely surgery save lives. Beyond the physical impact, accidents affect mental health, requiring support and therapy. Road safety, awareness, and precaution are vital in preventing such incidents. Ali's story is a reminder. Accidents can happen in an instant, but knowledge, preparedness, and care determine the outcome. Every road user must respect traffic rules, wear protective equipment, and stay alert. Healing may take time, but with proper treatment and support, recovery is possible. Life resumes, but awareness remains. A lasting lesson learned in the blink of an eye.